So, in this series, we'll be studying right atrial enlargement. You can also call it right atrial hypertrophy. Well, whichever is fine. So, now, in right atrial enlargement, what you see is for the P wave, they are best seen in the lead 2, 3 AVF, like basically two places where you can see this P wave, that's the right atrial enlargement, specifically lead 2 and lead V1. You can also appreciate it in 3 and AVF. But then I don't want to bore us with too much. So when you're seeing the amplitude, okay, before I go into that, let me show you an image. In lead 2, that's the P wave to be specific. The initial part of the initial part is the right atrial component, and the second part is the left atrial component. You see this is the lead 2 that I'm seeing. Then the lead V1, that's in V1, the initial positive deflection is the right atrial component, while this the next one, which is a negative deflection, is the left atrial component. So it means that when you're trying to for lead V1, you should be, when you want to check if there's an hypertrophy of the right atrium, you are focusing on the initial part, and for that one, when the amplitude in these initial parts, when it is greater than 1.5 millimeter, that is right atrial enlargement. Then for lead 2, when the amplitude is greater than 2.5, that is right atrial enlargement. So okay, what I've said is demonstrated in the image below. So if you look at this, when you see this properly, you will see these are normal. This is a normal finding. This is normal. This is also normal. Are you getting me? It says the normal P waves in lead 2 and V1. Those are normal findings. But now in B, you will notice that this is greater than 2.5 mm in amplitude. And when you look at this one, as this, you will see that the amplitude, the initial, okay, let's do it like this. This will help you. This is the initial, this is the initial component. That's the initial component. And that initial component is for the right atrium. So in lead V1, when this is greater, that's this height here, is greater than 1.5 mm, that shows right atrial enlargement. So it's very easy to get. And like I said, when you are seeing right ventricular hypertrophy, one of the things to support the diagnosis is a right atrial enlargement. So I said it's best seen in lead 2 and V1. That's changes in the P wave, which signifies the depolarization of the atrium. So that is that about this series. Oh, before I end, causes chronic lung disease, tricuspid stenosis, congenital heart disease, then primary pulmonary hypertension. So I think that should be all for now.